or a loved one injured due to medical malpractice arising at the Alvin York VA Medical Center in Tennessee? I'm Paul McConnell from the Doctor Lawyer team. I'm going to talk to you about some of the more common medical malpractice areas that we see arising at the Alvin York VA Medical Center in Tennessee. The most common area of medical malpractice we see is not following established and standard screening protocols. That is, when patients present at emergency rooms, or in some cases to their primary care doctor, with symptoms that obviously require additional diagnostic testing or referral to a specialist. For example, if a 50-year-old smoker presents with a cough, they should have a scan or an x-ray done. Or if a young 23-year-old presents to the ER with a fever and abdominal pain, they should be screened for appendicitis. These are just two types of cases to illustrate what we see far too often. Additional areas of medical malpractice that we see far too frequently include delay in diagnosing cancer, misdiagnosis or incorrect diagnosis of a serious illness or disease, surgical mistakes, including leaving equipment, tools, sponges inside the body. These are sometimes referred to as foreign body cases. Failure to monitor serious conditions, wrong medication prescribed or administered, failing to prevent falls in high-risk patients, wrongful death caused by medical malpractice, or failure to diagnose or treat a stroke, spinal cord injuries due to surgical negligence. Of course, there are many more areas, and this is by no means an exhaustive list of the types of medical malpractice claims that we pursue. Our firm is experienced in prosecuting complex medical malpractice cases, and we're intimately familiar with the health care provided in military and VA hospitals. My partner, Dr. Michael Giordano, and I are both retired military veterans. Dr. Mike is a board-certified neurosurgeon. He served in the Navy as a surgeon for 30 years of active and reserve duty and retired as a captain. I served for 30 years of active and reserve service as a Marine Corps infantry officer and later as a judge advocate. We both deployed for multiple combat tours, and we come to work each day inspired to help active duty service members, their dependents, as well as veterans. The Federal Tort Claims Act is a very particular mechanism for bringing a suit, and lawyers who aren't familiar with it can often make critical mistakes. Or even if they don't make an error per se, they may not advance your case as well as it could be if you have a practitioner with specialized knowledge and experience with the Federal Tort Claims Act. You will want a lawyer who understands federal court and the Federal Tort Claims Act. And not every malpractice lawyer does, even though they may otherwise be an excellent or outstanding lawyer. Medical malpractice claims and lawsuits are complex. They require investigation, skill, money, and resources. In all events, medical malpractice is far too prevalent and can have long-term profound consequences. Contact us for a free case evaluation. We're built different. Join the team.